Hello everyone, today I'm going to talk about visual pathway and common lesions involving the visual pathway and their effect on the vision. Okay, so on the left side of this image we see the visual pathway, and on the right side we see the effect of damaging different parts of the visual pathway. So here those two are your visual fields. This is the left visual field and this is the right visual field. So let's divide this visual field into, this is nasal, close to the nose. Suppose this is our nose here. So this is the nasal visual field for left eye, and this is the nasal visual field for the right eye. And this is the temporal visual field for the left eye, and this is the temporal visual field for the right eye. And the interesting thing is the nasal visual field information is carried by the temporal fibers of the retina, and vice versa. The temporal visual field information is carried by the nasal fibers of the retina. So here the temporal fibers are shown on the green and the nasal is shown on this brick red color, and in the right eye the nasal fiber is shown on the green and the temporal fibers are shown on the brick red color. And after those fibers emerge from the eye, it's now the optic nerve. So the optic nerves merges together at the optic chiasma. So this is the location, this is just above your pituitary gland, and this is the location where the nasal fiber of both of the retinas crosses the midline and goes to the opposite side. So the nasal fiber of the right eye will go to the left side, and the nasal fiber of the left eye will go to the right side. Okay, so this is the right side. And after crossing over, now you have something called optic tract. So this optic tract, as you see that this is colored as green, so this optic tract carries information from the nasal visual field of the right side and the temporal visual field of the right side. And what you can see here is actually this person's right part of the visual field of both eye is carried, the information from the right part of the both visual fields is carried by the left optic tract. So this is the right part of the left visual field, and this is the right part of the right visual field, and those both right parts of the visual field are carried in, the information from those parts are carried away by the optic tract. So this is the optic tract, and then optic tract goes on to meet the lateral geniculate nucleus, which processes the information, and after that we have something called optic radiation, something like that. And optic radiation has two parts actually. So the upper part here is called the Meyer's loop, which actually traverses through the temporal lobe, and the lower part is the optic radiation, also known as dorsal optic radiation, which actually traverses through the parietal lobe, and ultimately both of them actually go on to innervate into the, or go on to the occipital lobe. Okay, so this is the basic idea here. And about the Meyer's loop and dorsal optic radiation, which is right here, Meyer's loop actually carries information from the lower part of the retina, and the dorsal optic radiation carries information from the upper part of the retina. Okay, and if we see in the visual field, Meyer's loop actually carries information from the upper visual field, and the dorsal optic radiation carries information from the lower visual field. Okay, and then we have the occipital lobe. So let's see what kind of changes we get when we have some damage in those pathways. So as you can see here, the first one is the monocular scotoma. Suppose someone has diabetes or macular degeneration, which is a disease involving some part of the retina. So if some part of the retina is damaged, there will be no vision on specifically that part of the retina, leading to a blind spot. So here you can see a blind spot on that part, actually telling you that this specific visual field is lost because the retina that represents or that carries information from that visual field is actually damaged. And then if you transect optic nerve on either side, it will lead to complete blindness of that eye. It is known as anopia. So if you cut the right optic nerve, you get the right anopia. If you cut the left optic nerve, you will get a left anopia. And the next one, which is very important, which is C. And C, as we have already mentioned, C is the site of the optic chiasma. And here, the nasal fibers of both eyes cross over. And as you can remember, the nasal fiber carries information from the temporal visual field, which is the side visual field or the peripheral visual field. So the peripheral visual field is covered by the nasal fibers of the retina. And that's why whenever you have damage to the optic chiasm, which damages both of the nasal fibers, both of the nasal fiber tracts from both eyes, now you will not be able to see the peripheral vision, or you will not be able to see anything peripheral for both of the eyes. So that is called bitemporal hemianopsia or hemianopia. So this part of the visual field and this part of the visual field, which are the peripheral visual field for both eyes and which are carried by the nasal fibers from both eyes, now they will be absent. So the patient will have something called a tunnel vision. So the patient will not see anything on the side. He or she will bump onto people or bump onto a door, and sometimes he or she will have accidents when driving cars because they cannot see anything sideways. So that is very important. And one of the most common cause of bitemporal hemianopsia is any disease that causes enlargement of the pituitary gland, or any or cellular like pituitary adenoma or craniopharyngioma. Both of them can cause this damage to the optic chiasm, leading to bitemporal hemianopsia. Very important. Next, we have something called a right nasal hemianopia. So as you can see here, on the right side, these brick red fibers are the temporal fibers from the right eye, and they carry information from the nasal visual fields of the same side. And if you damage these temporal fibers, you will have lesion involving you will have loss of your nasal field. So that is why we have something called right nasal hemianopia. Hemianopia means that you cannot see on that specific half of the visual field. That's why it is hemianopia. Okay, and next we have damage to the optic tract. So this is the left optic tract and this is the right optic tract. And the right optic tract actually controls our left side of the vision or left visual field for both eyes, and the right optic tract controls or carries information from the right visual field of both eyes. So if we damage the right optic tract, what will happen is our left-sided vision for both left eye and right eye will be lost, and that is why we'll have something called left homonymous hemianopsia. Left homonymous hemianopsia, meaning it's a fancy word for that loss of our left side of vision. And next, on the F, you see that there is damage of the mild lobe, and mild lobe actually helps us to see the upper part of the visual field. And what we'll have is we'll have left homonymous superior quadrantanopia. So that tells us that we'll not be able to see our left side of the visual field of both eyes for left eye and right eye, because right myal lobe is for left side of the vision. Right myal lobe is for left side of the vision, left side of left eye and left side of right eye. And not only that, then if we go one step further, that right myal field is for the upper part of the visual field of both eye in the left side, meaning that for the left eye we'll have lost our superior quadrant of the temporal part or temporal visual field, and for the right eye we'll lose the superior part or superior half of the nasal visual field, and that is the left side. So this is the part of the left visual field of the right eye, and this is part of the left visual field of the left eye. So we are losing a upper half of our left visual field due to damage of the myal lobe. And if someone has damage of the dorsal optic radiation, which is responsible for the information from lower visual fields from the contralateral side of vision, what we'll have something called left homonymous inferior quadrantanopia, or also known as pie on the floor. So here what we are having is that as there is damage to the dorsal optic radiation and we are not able to see the lower half of the vision on the left side, we'll have something called inferior quadrantanopia, and it will be as the damage is on the right side, the visual loss will be on the left side, and we'll have this left homonymous inferior quadrantanopia. Okay, this is also known as pie on the floor, and here you see the defect. So this is the pie on the floor for damage to the dorsal optic radiation, and this is pie on the sky due to damage on the Meyer's loop. Okay, and whenever someone have damage to the occipital lobe, what we'll have it's called homonymous hemianopia or contralateral homonymous hemianopia with sparing of the macula, because macula has blood supply from the middle cerebral artery, and that's why there is sparing of the macula, but there is contralateral homonymous hemianopia. So if someone's left occipital lobe is damaged, he will have a right-sided contralateral, which is right-sided homonymous hemianopsia, and vice versa, and there will be sparing of the macula. Okay, so that's all from me today. Thanks all for watching my video.